Thank you all for taking the time to join. Yeah, I'm going to give an overview of the most recent work we've been doing at WorldPop around mapping populations, distributions, and demographics. And for those of you who don't know, WorldPop, we're a applied research group at University of Southampton in the UK. There's around 40 staff and really focused on trying to produce those kinds of data sets you see on the left there, of trying to map population counts, characteristics, mobility patterns at small area scales, and make those data methods open as possible, and not only producing the data sets, but applying them and co-developing them with governments, with UN agencies for specific purposes, mainly around development and health areas. So today I'm going to start off with just background as to why small area population data are useful. I'm sure you know as survey statisticians, but then the role that geospatial data can play in producing those. Then go through the kind of example applications that we've produced at WorldPop on firstly global population mapping, then a more bespoke national population mapping for specific applications and purposes, and then some overview, smaller bits on population characteristics and dynamics. So I probably don't need to tell you all, but small area population data is pretty useful for lots of things. The way we run countries, plan elections, taxation, survey sample frames, health metrics, disaster preparedness, and interested also in small area population data for answering scientific and methodological questions. So how much do population densities and demographics actually vary at local scales? What are the drivers of population distributions? Why do we see higher population densities in some areas than others? What data and methods can most accurately model and map these spatial demographics? And then how do they change at small area scales? How do populations move? And by able to answering these kind of questions, it helps us with specific applications. So if there is a disaster, how many people are affected by the disaster? Where should we deliver aid? How many children are in my school catchment area? How many do not have easy access to education? How much vaccine is needed? Where and how to deliver that? And then how many people are moving or migrating, and how does that mean that diseases are likely to spread? So all of these questions, you need some kind of small area population data that is recent, reliable, but in many of the most resource poor settings in the world, we have challenges in terms of demographic data. Firstly, we think about the most basic source of population data we'd like to have, the National Population and Housing Census. In some countries of the world, it's been decades since the last one was undertaken. Plus, we often have the situation of a lack of complete registry and administrative data systems, that if we had those instead of a census, we could at least produce some updates and estimates. There have been disruptions to the 2020 round of censuses because of COVID, stopping door-to-door enumeration. And then some of the censuses that have been done in some countries, we've seen large undercounts that have caused problems and questions about the quality of the census data. And then even if we do have a recent, reliable census, of course, there are variations that happen at small scales, especially varying fertility rates that mean that predicting in between censuses those changes in populations can be difficult. There's obviously a migration that is ongoing everywhere, and in some of the most conflict-affected settings, there is a lot of displacement ongoing, all of which makes it difficult to keep up-to-date population estimates at small area scales. So we're faced with these kinds of challenges where data may be available, but it sometimes is a coarse resolution from projections, estimates, or data can be outdated, incomplete, or just missing. So at the core of what I'm going to talk about today is this attempt to map the correlates of demographic variations. So unless we have unlimited resources and unlimited manpower, we can't go and count everybody everywhere all the time at small area scales. But increasingly, we can assemble data sets on things like buildings, vegetation, to build up a picture of the landscape and update that regularly. And I'll show how geospatial data sets that have improved massively over recent years can then help and support this. So when I was doing my PhD, it must have been, I don't know, we must be coming up to about 30 years ago now. This was the kind of satellite images we had available, and we couldn't really do much apart from distinguish maybe fields and a city and sea, water bodies. But obviously over the years, things have improved massively, and we now have images where we can pick out individual buildings, people, cows. And over the last 5 or so years, we have seen the advent of incredibly powerful algorithms, computer vision, AI, that can, in a fraction of a second, with the right training data, be able to extract useful features like this, individual buildings, from those images. And this is all rapidly changing. I mean, just 2 weeks ago, Google released this most recent open buildings data set that has about half the world mapped in terms of individual buildings for each year from 2016 up to 2023. They're continuing to update it. They have building height estimates as well through different angles from shadows. So it's not only this kind of data that's improving, but also the kind of contributed data from things like OpenStreetMap, where we have not only buildings, but roads, points of interest, all things that can help us understand a bit more about why we may see higher population densities in one area than another, or why we may see different types of populations in one area than another. As I mentioned, there are building height data sets that are becoming more and more accurate and available across the world. And there are efforts to try and, again, train AI models to recognize things like damaged buildings, abandoned villages, refugee camps, migrant settlements. So the geospatial data sets are improving rapidly. In WorldPop, we then try and extract as much extra information from these data sets as possible. So not only the presence of buildings, but processing those data to try and get information on building densities, counts, areas, lengths, patterns within that data. Use those patterns to try and then segment out where are different types of neighborhoods, and where are the informal settlements, those areas that might have much higher population densities than others. And where are the residential buildings and non-residential buildings, trying to then classify those data sets so that we can have a better indication of where populations are likely to be and where they're not likely to be. And it's not just satellite images of the Earth in the daytime. We have images of the Earth taken at night that can give us some indication of electrification, presence of populations. You end up with amazing patterns like this of kind of South Korea extensively lit up, and North Korea, maybe just Kim Jong-un's house, I'm not sure. We have vegetation amount, we have topography, we have land cover, all now produced in some cases every 10 days at 10-meter grid squares. So incredible amounts of data coming through that can help us. But it doesn't give the whole picture. And another source of data that can help us in a different way comes from the types of things we all carry around with us, from mobile phones. Obviously, 20, 30 years ago, it would have been a pretty useless data set, and with only a few people in the world actually having a phone. Now there are more phones than people on the planet. And the real value from those comes in different ways, in terms of, firstly, whenever we make or receive a communication, send a text message or receive one, it's routed through the nearest mobile phone tower, and it's anonymously recorded for billing purposes, and the timestamp. And then if we move to a different location, it's routed through a different tower. And so we have this kind of digital breadcrumbs that are being dropped, showing the movement patterns anonymously. And when you aggregate these kinds of data together across entire countries of millions of users, you end up with the kind of insights that we've never seen before of the movement patterns of devices across countries. As well as that, we now have these tech companies that are looking at able to access things like location history. So Meta, like the phone users who are using Facebook and enabling location services, aggregating that data so that there's no way you can identify people, but it gives valuable insights in the changing densities of those populations and the movement of those populations. So with an aim here then of going back to this ability to try and capturize and characterize the landscape. So maybe it doesn't look so much like this, but in reality, it can be something like this, where we have 100 or more different layers, each measuring something slightly different about the landscape, whether it's the presence of buildings or topography or land cover, that can give us an insight on the landscape that may or may not be related to population presence. And this then feeds in as a component of trying to estimate and predict populations. So the ingredients here are some form of population data that we trust, some form of settlement data, whether that's buildings or just the outline of settlements that tell us these are the areas where people are and these are the areas where people are not. And then these geospatial stack of covariates to help us understand within those settled areas what are the variations in population likely to be. Then we have different types of spatial statistical models depending on the purpose of what we're trying to do. And ultimately, we're trying to produce population estimates, ideally with some form of uncertainty measure, confidence interval around them, but at this grid square scale. And so you'll see in all the outputs I present, we're trying to produce these gridded population estimates, approximately 100 by 100 meter grid squares. Doesn't mean we are 100% confident that there are 21 people in one grid square every moment of every day of every year, but it does give us this flexible framework to then be able to work with other types of data and to be flexible in the way that we summarize or aggregate these data. So often when we're working with governments, UN agencies, others, the gridded data is not really the data that is of interest. It's the ability to aggregate it to administrative units, health units, enumeration areas, or to be able to sum up those grid squares within a settlement and come up with an estimated population of the settlement, or to link it with other data sets, so location of health facilities, and be able to more precisely calculate how many people are living within 5 kilometers of a health facility, for instance. So the first thing that we've been doing in WorldPop for many years is trying to work out ways to produce a kind of consistent gridded data set of population across the entire world. So I'll start with the global population mapping, and what you'll see we do is 2 broad types of modeling approach. Top down, where we have a count of people per administrative unit that covers an entire area of interest, and then we have disaggregating to the grid square scale. The other type that I won't talk about quite yet, come later, is the bottom-up approach, where maybe we don't have data that we trust across an entire area, but we just have some sample data, maybe from household surveys and listings or some other source that we've got access to, and we're trying to predict into the unsampled locations to produce grid square estimates. So for the global approach, this has been an approach that has been around for this kind of top-down approach for the last, I guess, 30 years now. In the 1990s, these simple aerial weighting approaches started up, where we may have an administrative unit with 54 people in, and a unit with 36 people in, and we simply equally spread people across those grid squares. As things have advanced, then we've had the availability of new types of data. So on the decimetric approach on the top right there, we may have some satellite-derived measure that tells us in the dark grey area there is a city, and so we can push people into that city and spread them out equally in the city. Or we may have, in the other decimetric approach, a way of working out how many people we think should be on different land use classes. But as things have advanced and statistical validations have come along, these approaches now that, in the bottom right, that are produce statistically derived weights from a stack of data and multiple ancillary variables are the ones that have really taken over. And over the past 10 years, this is the approach that we've been using at the global scale, a random forest machine learning model, where we are learning the relationship between the population density at the aggregate count scale and the covariates at that similar scale, and then applying those learnt relationships to produce a population density weighting layer that is then used to disaggregate to grid squares. This is an approach that you can play with yourselves. There's an R package of this POP-RF, a random forest informed population disaggregation. Comes with all kinds of demos. It tells us something about the different layers that we put into there and which ones are the most important in predicting population densities. And just to visualize what it does, we may have population count data like this from northern Vietnam, where each unit has about 1 million people in them, which is not so great if we're trying to understand how many people are within 5 kilometers of a health facility, for instance. But what we do have at the finer scales, of course, is this building mapping that can tell us something about the populations should be within those, the residential populations should be within those areas where there are buildings. And then we have other sets of data in our stack, maybe something that tells us about the land cover in an area, something that tells us about the brightness of the area from satellite images of the Earth at night. So that we can then learn the relationship between these coarse scale population densities and the finer scale data, and apply that random forest model to disaggregate to 100-meter grid squares. And the nice feature of this random forest model is that it can be quite easily-ish scaled up to a global scale. So these are the kind of age, sex structured subnational census units where we've worked with others, where we're just about to do a full update of population counts assembled across the world from multiple censuses mapped to their boundaries at a smaller boundary level as available. We then select a set of these covariates derived from tests over the years where we've compared against really detailed census data to see which are the types of geospatial data sets that best explain population distributions. And then we assemble those globally at the 100-meter grid square scale, and those ones on the screen there are all openly available for you to use, and we're soon to be releasing a new set of those. And of course, we also want to be able to, if we're doing multi-temporal mapping, be able to map the settlements and their changes over time. So a couple of examples on the screen there of what we've done in the past, and the outputs from a new set of data that build on the kind of building footprints, multi-temporal data. So that enables us then to disaggregate to those grid squares across the entire world. Our global data sets are available on those UN population data portals, the ArcGIS Living Atlas of the World. Look like this, and obviously have age and sex breakdowns for each year in them. And yeah, making these openly available has led to different agencies being able to use them in different ways. So we've seen the linking up with air pollution data to estimate how many people are exposed to different levels of pollution each day, estimating populations exposed to disasters, so flood extents here. I was surprised to see that IHME and Imperial College both using these data sets in their COVID models that were used to prompt lockdowns, and the health information system software that's used by about half the countries in the world have these data as part of them. As well as more national scale analysis looking at conflict exposure, children who are unvaccinated, and access to schools. So as part of this presentation, I want to also get you thinking about new directions, the skills that you have, where if there's any areas you see of interest for collaboration, then it'd be fantastic to reach out. There are things that we are thinking about, and some we've already started looking at, of small area forecasting methods, thinking about how we can improve mapping within urban areas, new sources of training data for these models that may come from things like geolocated large language models, daytime and nighttime population distributions, and then there are a set of new approaches, some of which we've developed ourselves that we're testing, and some of which are in collaborations with, for instance, ETH Zurich have done some nice work on directly estimating from satellite imagery to be able to be more readily update those population estimates. But those all have a kind of limitation in that in trying to map populations globally across multiple time periods, we need to have consistent data sets, and we necessarily need to cut some corners and use data sets that are comparable across the world. So when we're working with an individual country, it often means there are better data sets available, or there are special needs for a country that the global data sets don't meet. And this is where, across the last 5 years, a lot of our work has involved co-development with governments, where we're working together to understand what are the needs of the government, what data exists to meet those needs, especially what skills exist within statistics offices or ministries of health to be able to take on and own those solutions and be able to present and communicate them to the rest of government, and then co-develop research and training plans together. So just here, particularly acknowledging many of the ministries of health or national statistics offices we've worked with who have kind of taken that leap of exploring and testing and working together on new approaches. And so acknowledging in all of these examples those different countries. So a few examples. Firstly, if we're thinking of the top-down disaggregation, there are countries that have wanted to be able to produce a gridded version of their census. So here are examples for Kenya, for Mozambique, Sierra Leone, where we've taken their census counts and then be able to disaggregate those to grid squares using the random forest approach. And those have been able to be made openly available as a way to distribute their census data in an alternative form. And often there are questions that come about when we're collaborating of, does this really work? Does this really produce estimates that are accurate? So in some cases we go out in the field and with those statistics offices and test different types of models to see which ones work. And in this case, this is Mozambique for an area where they went and counted everybody in a certain area, and the random forest approach in Model 3 was the one that worked really nicely. There are also situations where there's a need for rapid estimates, and maybe there are no census data available, but there are common operational data sets for humanitarian response. And this was the situation at the start of the Ukraine war, where there was no census since 2001, but there were registry data that could enable updates at individual cities, but also province scales. But this was not detailed enough for the kind of responses that were needed, so we worked to implement those types of top-down disaggregation again to produce these updates rapidly. And then there are situations where a specific population group has an interest in having those estimates at smaller scales. So UNHCR have a register of refugees, but to be able to design sample frames to target in particular those refugee populations, there was an interest in disaggregating these registers to finer scales to be able to then produce new sample frames. So as an example here from Cameroon, mapping those refugee populations. So this, all that I've presented up to now, I think in these types of challenges, we've maybe worked out a way to address this coarse resolution problem. So we're taking some kind of aggregate counts and disaggregating them to grid squares. It leaves these challenges of what if we don't trust that aggregate data, if it's outdated, if we only have a small bit of data that we trust, what can we do? And this is where the bottom-up modeling approach comes in. So here we're thinking about situations where we don't trust census data, we don't trust the projections that exist at coarse scales, but maybe we have some other form of data, sample data that we do trust. Either we're working with field teams to go and collect that data ourselves, or there is some secondary source of data that enables us to use that, and we know where it's come from, we know how it was collected, and we can use that as a basis for predicting into those areas that weren't sampled. Just to visualize this, so maybe we have population data that were collected in these yellow areas, or sorry, in the brown areas, but we don't have anything in the yellow areas. Maybe these areas are too unstable, there's conflict in those areas and population enumerators could not go to them for a census. Or we may have the reverse situation where there are small area enumerations were able to be done in the brown areas, but there were huge areas that weren't covered. But of course, what we do have across the entire area of interest are these geospatial data sets again. So we have things like the buildings map from satellites, vegetation amount, night light slope. And so what we're doing in simple terms is looking at the statistical relationships between where we do have the population data that we trust and this set of 100 or more geospatial data sets. So just showing here examples where population density in the places we can measure compared against building density or against slope or against night lights. And often these are very messy, uncertain relationships. But the more of them that we build up with the more different types of geospatial data sets, and sometimes even mobile phone data sets, the better we can do in terms of characterizing those relationships. And so we're then building those statistical models that bring together multiple geospatial data sets with an aim of ultimately filling in gaps and producing estimates at the grid square scale with uncertainty estimated in them. So that's a broad overview. This is a very much ongoing, active, evolving research area where the different challenges were faced by different statistics offices, different geographical settings, different data types, means that each time we're often having to develop new types of approaches and new components, whether it's thinking about migration or displacement, or building in the situation where buildings cannot be seen through canopy cover. And there are a growing number of published models and different ways of doing this. So you can think about it as that we're trying to build up a toolbox so that when we are working with a new country or a new situation, we have a way of looking back and saying we could potentially use this model or this approach. And in all the examples I'm going to present, it's very much an iterative procedure where we are working together and seeing what type of data exists, working together on identifying those geospatial covariates, creating and linking those data sets, testing the relationships, selecting predictors, developing and testing different types of models, and then going round and round in circles until we come up with a final model selection. And I'll go through now some examples of where we have worked with governments to do this. So one of the first examples with UNFPA and the Afghan Statistics Office back in 2018 was this, where there had been no census since 1979. And there was a strong interest from President Ghani at the time to produce new estimates that weren't reliant on simple projections from the 1979 census. The government had been able to collect data in these pink areas, but the white areas were Taliban controlled at the time. We were able to work with them to identify some safe areas to go and collect extra data to try and get a more representative picture of those Taliban controlled areas, and then use those to develop a Bayesian hierarchical model, in this case, to predict into those unsampled locations. The cross-validation produced pretty good results in this case, giving us some confidence in those predictions. But unfortunately, this is a Bayesian model, so that we are measuring and capturing that uncertainty that in those areas that are very different from where we had training data, and we're a long way from our areas where we had data, and we're a lot more uncertain in those predictions. So these were presented in Kabul to the president, and as far as we know, still in use. We hear from people like the World Bank that these data were able to result in additional 15 million in financing. So there's now 1 million extra kids who were vaccinated because of these estimates. There are often a lot of questions about how accurate these model estimates are versus census. So here's an example we did with the Zambia Statistics Office using, in this case, listings from household surveys that they conducted in 2017, 18 and 19 that gave us counts in defined clusters as the training data. Those are then used, again, in a Bayesian hierarchical model to make predictions at the grid square scale to help with their census planning process and for health delivery campaigns. But since then, they've been able to conduct a census in 2022. So these are kind of early results, but we're starting now to really dig into the comparisons to see how well are these estimates with their confidence intervals lining up with what was actually found when the census was undertaken. We're finding generally pretty good results, but there are interesting outliers that may help us improve things. And just in a similar way, Cameroon here had no census since 2005, interested in producing estimates to support their census preparations when they eventually do a new one. And there was a set of household surveys here that could be, each one had a listing, an account of those populations in a much more recent time period that could be used to produce predicted counts with uncertainty metrics. And the co-development approach meant that we now have a team in the statistics office who are fully able to explain and work with these data sets and adopt them and use them. In Papua New Guinea, there weren't any kind of household surveys in a similar way, but there was a big health survey where they distributed bed nets and counted populations while they were doing that. So in the situation where they haven't had a census since 2010 and COVID delayed their 2020 census, it meant that these approaches could be used to produce new estimates with confidence intervals again, and these are the ones that when you go to the Papua New Guinea Statistics Office are on that site. We also have the situation where there were no household surveys that really could be trusted. And so this is the work in Nigeria where field teams went out to each of those survey locations, counted populations in defined areas, and then those were used as part of a Bayesian hierarchical model to produce population estimates that were then a component of vaccination campaigns in terms of producing these microplans where you have an estimated population of children under 5 and estimated number of households. You can see those in use there. And what has really boosted things since that Nigeria example is the ability and the availability of house building footprint maps from satellites. So when we came to work with Democratic Republic of Congo, their last census was 1984, we were able to work with field teams to collect data again, to train the models and get an even better fit to those models, and the predictions were then used as the basis of health campaigns distributing bed nets and vaccines. And then there's a situation where a country has done a census or is preparing for a census, but there are certain areas that could not be reached. So these, in Mali, these dark grey areas are ones where there was deemed to be too unstable, too much conflict. They could not send the enumerators there. So in those areas, the model was that the data that could be collected was used to fit a Bayesian hierarchical model with these geospatial covariates to produce predictions into those areas. And in a similar situation, Burkina Faso, these blue areas too unstable for census data collection, and the rest of the data was able to be used to make those predictions that fed into the preliminary census results at the time. And a final example here from Colombia, quite interesting, because here there were areas again where it was too unstable to go for the 2017 census. But here the ability to test both the geospatial data sets, so for instance, total building area as a covariate, versus also this social cartography, so working with local community representatives who are estimating their population in their area. One source of data, the social cartography, was often quite unbiased but not very precise, whereas the building data was quite precise but quite biased. So the two together produced the best model, and those were then used to fill in those gaps in the census. It's the Director General presenting them at the time. And then in some cases we have this big displacement going on, so the ability to incorporate displacement data from things like IOM displacement tracking matrix data into those predictions enables both new estimates that have been now gone through Parliament and adopted, as well as the basis for sample frames for the collection of new data, which can then in turn feed back into improving population estimates. So you can explore most of those data sets I've presented in this tool called Whopper Vision. You can click on locations, you can draw a polygon, and you can get the estimates in the case where they're Bayesian models for the full posterior distribution. So you end up with both a population estimate and a confidence intervals around them. And the value of having those uncertainty metrics is in some cases thinking about how much vaccine do we need. If we really want to make sure that 95% of children are vaccinated, we maybe want to use the upper confidence interval. We want to be really sure that we're covering those children. So we're using the upper limit to say, take this much vaccine, because then we're pretty sure that we're going to cover them all. Or we may have a situation in planning for a census and drawing new enumeration areas to making sure that those enumeration areas are not too big that a person cannot cover them in a day when they're undertaking their census. So again, there are, I think, lots of directions for future work. We're thinking about ways of building in this more regular building mapping that groups like Google are doing. There's approaches to building in the temporary, abandoned, damaged structures that can be now better detected from imagery. Work ongoing on trying, as always, to try and get a better idea on nomadic and mobile populations in places like Somalia, and accounting for displacement and migration. And just at the end of this section, improving sample frames is something a lot of work has gone into, thinking about using these gridded population data sets in combination with layers on things like road networks, rivers, to define enumeration areas or sample frames that follow natural boundaries, so that teams on the ground can either update old enumeration areas or define new ones. And there's a whole set of countries that have started to use and adopt these types of approaches. So before I get to the dynamics, just the population characteristics. So going beyond just population counts and their age and sex structures, I think you're all familiar with the way that national household surveys are done, where you may have clusters of that field teams go to and interview households from a selection of households in each one of those clusters. Maybe this kind of thing in Dakar, one side of the river, the other side, the more richer area. We may have then data from all of these locations across the country that gives you in different types of indicators, and it may be poverty, it may be literacy, it may be sanitation, that geolocated cluster data. And it's a similar situation as our bottom-up population estimation. We have samples in some locations and a lot of areas that we need to estimate in if we're going to produce small area estimates. And we may see relationships in those locations and to geospatial things that we can measure from the geospatial data sets. So we may have rates of poverty that are higher the further you go from the main road or the closer you go to an urban area. We may have more urban areas with lower poverty. We may have areas that are more vegetated, of having higher poverty, more rural. But also we may have links to these kind of mobile phone metrics. So if you're using your phone more at night time when calling rates are lower, that may be an indicator of higher poverty. We have higher mobile data spending we see from academic studies that are correlated with lower rates of poverty. And we have higher rates of mobility, also correlated with rates of lower rates of poverty. So each one of those, again, are messy, uncertain relationships, but the more of these things we can bring together and measure, then the potential is there to be able to better predict things like poverty. So we can measure that remoteness, maybe the distance to the nearest remote road. We can measure think about urbanicity from nighttime lights. We can measure that amount of vegetation, the greenness. But also we can use the mobile phone data where we have collaborations with a phone operator, or we're using some indicator from a big tech company like Facebook on percentage of calls made at night, the amount spent on credit each week, or the amount of mobility in this case. And again, when we bring these together in a geostatistical model, we can make those predictions of wealth index that are not too bad, but importantly, measuring that in a Bayesian model, measuring those uncertainty rates as well, and that some areas don't seem to work so well as others. So these are kinds of approaches many of you may be familiar with. There's lots of groups using them now, where you're using geospatial covariates to be able to predict something. In this case, an example from vaccination coverage from Edson Utazi in the World Pop Group, and then developing these approaches with, in this case, Nigeria National Primary Healthcare Development Agency, to link with the population data sets and identify where they're likely to be areas of low vaccination coverage. And these kinds of data sets were then used to prioritize the 100 wards to follow up on vaccination campaigns. And the aim is ultimately to build up this kind of library characterization of the population. So we're not just thinking about population density, but breaking those down by the children under 5, the proportion receiving the first dose of measles vaccine, female literacy rate, poverty rates, and we're just about to make available this new tool that displays some of these data sets and also looks at multi-temporal changes and using those Bayesian confidence intervals to look at significant changes or not that have occurred. So yeah, again, the future, there are lots of things I think it would be really interesting to hear about and collaborate on in terms of moving beyond just household survey data, routine health facility data, administrative sources, be able to better model and map changes, integrate with things like demographic surveillance system data, synthetic populations, and modeling components, so fertility, mortality. Can we bring in also migration to do a better job of small area population projections? And that brings in, I think, a final component. So there's population dynamics. And I'm only really briefly touching on this. I think there's a whole other talk that could be done on this, but there are different ways of trying to measure population change and mobility. Up until maybe 10 years ago, we really only had census and registry data, household surveys, cross-border and traffic surveys, and each of these are still vital in terms of anchoring and validating new sources of data that are on the right, that may come from mobile phones, GPS, and other sources. So hopefully this works. This is quite an old video now from a paper we did maybe 10 years ago, but it's still a nice demonstration of how mobile phone data has the potential to capture some of these population dynamics that we've never been able to see before over large scales. So France did a census around the same time as we had access to phone data, and we built a simple model to translate between density of phone users and the density of population and then that worked pretty well, and we could then use the phone data, which is collected every single minute of every single day, to map out changing population distributions. So here we see, yeah, Monday across the country, everybody mainly working in the cities, Tuesday, Wednesday, Thursday, and then Friday, Saturday and Sunday, very different population distributions as people go into the countryside. And then, of course, July and August come along and the coasts get filled up. And every time we look at data sets like this, we're amazed about how much people move. And of course, that's valuable for France to have this kind of data, but they also have very many other sources of data. But that becomes particularly valuable in settings like this, where the Nepal earthquake occurred in 2015, a really major earthquake, and in those kind of situations, understanding where people had been displaced to when their homes were damaged becomes really important in being able to accurately and effectively deliver aid. So in this case, having access to those mobile phone data sets of looking at mobile movement patterns before the disaster and then seeing how the population flows have changed enabled us to work with these different response agencies to identify which areas people had mostly been displaced to. It also helps to test it in this case to see, could we actually replicate the migration statistics? There was a simple way of translating from phone users to estimates of movements of populations over the course of a year. And yeah, it gives some confidence that these kinds of data sets can be used to update migration statistics in the intercensal periods. And then there are opportunities we've seen a lot during COVID in terms of understanding how people moved or stopped moving during COVID. So this is London, and A is the first lockdown. We're seeing much lower population densities in the centre of London and much higher in the suburban areas. And then the different lockdowns, B, C, D, people respected them perhaps a bit less. We saw not so much staying at home. But also there are other forms of data that we can use to capture that mobility. So this is an example in Niger, where we didn't have access to any phone data, but we looked at the brightness of images of the Earth at night. Saw that in those areas where a lot of studies had showed that migrants move in to the cities in the dry season, when they cannot grow anything in the agricultural areas, the brightness increased as they turned on lights, lit fires, and those were then important for working with the Ministry of Health to time vaccinations for measles, because as people move in, it sparks major outbreaks that often result in a lot of children being affected. So just like in the population prediction, we can then think about bringing together all of these different mobility data sets or indicators of mobility. So whether it's the movement of phones, whether it's some kind of measure of growing season that prompts movements, whether it's urban-rural differentiation, we see different mobility patterns, the timing and location of school and major public holidays, the movement of smartphones, location histories, and those night lights. And we looked at, when we bring those together, we can get a not bad approximation of the seasonal population flows that we see from some of these mobile phone data sets, and then use those models to estimate changing mobility in different months of the year. So I'm finishing up here. Just again, the future things of population dynamics that we're trying to look at is all about really intercomparison of data sets. We know they're incredibly biased. We're just looking at phones moving around. So the more comparisons we do, the better. The ability of these data sets to help with the population mapping, identify perhaps where people are at night and more residential areas, and the linkages with the satellite insights. Maybe we can identify different types of displacements, locations. So hopefully I've shown that there are some ways, they may not be perfect, but to fill in these gaps of course resolution, outdated, incomplete data. And we know the data sets are in demand. There are the traditional data sources will continue to be absolutely vital for anchoring, training models, producing validations. But in many settings, they can be outdated, incomplete, and unreliable. These new data sets from satellites, GPS, phones can help complement those traditional ones, providing perhaps higher resolution, more regular recent data. But they're not perfect, so we definitely need to think about the models, the statistical approaches to quantify biases, use the appropriate models, and communicate uncertainty where possible. And if we're actually going to see the data sets used, then engaging with those decision makers is pretty vital to see sustainable uptake. So yeah, I want to thank the WorldPop team who did pretty much all of this work rather than me. And there are, the slides will be shared afterwards, but there are links here to training materials that we've produced with different agencies. There's links here to downloading most of the data sets I presented. And yeah, a couple of links there to packages around top-down and bottom-up modeling. So thank you.